start the introduction.
Here we go!
Today's video, I am actually on my way to my orthopedic surgeon because today we're going to do a whole full body scan, see what's been happening and see if me pushing to walk has done any damage. Welcome back to my YouTube channel, guys. This is your BBB, and if you are here for the very first time, I want to say thank you so much for making the conscious decision to come to the Bionic family. For my regular subs, you know we've been traveling so long and so hard. I hope you guys watched my last video. If you are not following me on social media, you can go ahead. The link is in my bio. You can follow me on all socials because yes, unfortunately they all have a different name. But in today's video, I am actually on my way to my orthopedic surgeon because today we're going to do a whole full body scan, see what's been happening and see if me pushing to walk has done any damage. So let's go.
Three hours later.
Oi! Leave on next time. Stop. Stop. Straighten up.
Good.
Give me the order.
No.
Are you having any pain?
Yes, I am.
Show me where you're having any pain.
Same here. Right.
The same, true.
Let's see.
I'm just,
Oh.
yes. Yeah, the same screw and can still feel it. But I know you said that that's the next area thing.
Stretch up there, stretch up there. Bend the knee. Nice.
I'm kind of walking-ish up to Gilbert.
Mm-hmm.
But my right foot keeps turning in like this.
Okay. I see what you mean. I was hoping you would have filled in by now. Okay. Do you get any pain in the right hip joint?
Only when I try to walk. Or yeah, when I try to walk, I get pain in it. But otherwise, I will only feel a sharp pain if I get up too quickly or try to get up without assistance. I hope something is not wrong there.
Well, we can see that the right hip joint is narrowing, which would suggest that you're developing some early arthritis in that. Which would suggest that you're developing some early arthritis in that right hip. So I don't want you to play any. What sports you do?
Hero.
What
I
sports?
don't do any sports. All I do is swim and ride the bicycle.
Yeah, man, you can do those, but I don't want you to do any track and field.
So that means no running, even not even light jogging.
No, I don't want you to do that. I want you to ride the bicycle and swim.
Okay. And there's nothing we can do to delay the arthritis, right?
Yeah, that's why I don't want you to
To do
run.
any running, okay. Will the narrowing prevent me from walking without any assistance? Or I just have to make up my mind to walk with a cane?
I need you to continue to walk with a cane.
Okay.
I don't understand why this is not healing fast then. When you stand, do you feel any pain here on the thigh?
The only thing that hurts is the knee.
Alright, so let me ask a question again. When you walk, you only feel pain around the knee.
No, when I walk, I only feel pain in the right hip. So I walk without the cane, I only feel pain in the right hip.
It's 6 months now. 6 months.
Is it that the cartilage is not any more than the last time?
I don't see a great effort by the bone attempting to heal at that side. You know, I would have expected by now it would have been
Almost healed?
yeah. Give me a minute, let me get my notes. What I'm going to be doing is with your permission, just discussing it with my colleague to see where we go next.
Okay.
Because we need to have this resolved so you can go back to work on it, won't we?
Yeah.
We reach to about 55. We're going to need a total hip replacement on the right side. But the Lord will come before then. Why not?
You have to work for that, one.
And that is a given. The hip replacement is a given.
Yeah, because I can see the hip wearing away already. And nobody in the house smokes.
No.
Dr. Gilbert, she needs to take back calcium or anything like that?
No, once you're eating normally, she should be good.
Okay.
Is there any possibility that I probably have to do another surgery?
That is a possibility. I'm praying that we don't have to. Not quite sure why it refused to heal.
Okay.
Can I ask you to... You have crutches at home? Can I ask you to start using the crutches?
Okay.
And let us see if that... Let's see if that will get it to heal. When I look at the x-rays, I can see some loosening around the screws in the distal fragment. So I'm going to put you on crutches and I'm going to see you back again next year to see if that will heal.
Okay.
Hello everybody. So no, this is not the next day, and no, this is not 2 days later. This is actually Sunday morning. So when I went to the doctor on Wednesday, based on the news that I got and based on what was happening with me, I just could not come to terms with my disappointment, and so it took me a few days. And ever since Wednesday, I'm gonna be honest with you guys, I've been crying day in, day out. I've talked to so many people about, you know, I have people in my circle that actually want updates on my progress, on what's happening with me, on my surgeries, on what I have left and how I'm progressing. And I mean, as you know, in my last video, I was actually, you know, taking on the obstacle of a hill, and I said to you guys that yes, I'm outside, so you're gonna occasionally see the vehicles pass behind me, because I'm still in the wonderful Irish town, and I don't believe that I should do the video inside, because I know I'm going to probably get a little bit emotional and I don't want the people around me to get emotional, so we're outside. But I have been crying since Wednesday, and I've cried every day since, because if you have not realized, this is the summary of my doctor visit. So remember, I did my bone graft surgery. If you didn't watch it, the link is up there. So I did my bone graft surgery, and the reason why I had to do a bone graft surgery was because my left femur was not healing. And my first surgery on my left femur was July 4th, 2019. It was the first thing that actually got fixed. But up to almost a year after that surgery, the femur was not healing. And so what they had to do was take a piece of my left hip bone, put it into my left femur, with hopes that at the end of the day, that new bone, that new growth will kind of, you know, push the femur to say, hey, we need to get some new cartilage, we need to heal this femur, deana-rae needs to be okay. So on Wednesday, it was 6 months after my bone graft surgery, and I thought I was doing everything right. I thought that I was going to walk by December 2020, but unfortunately that's not going to be happening. And the summary is this: my left femur is still not healing at all. The break is still there completely. On top of that, my orthopedic surgeon has said to me I can no longer learn to walk without assistance. I can no longer walk with my cane. I have to go back to crutches for the next 6 months, which means that's up until June 2021. And on top of all of that, I actually have to do a full hip replacement. Yeah, so at the end of the day, I have to do a full hip replacement. And on top of all of that, I actually, the chain that is in my right hip that connects my hip and my pelvis, it's actually narrowing the hip. So now I actually am suffering from arthritis at 34 years old. So yeah, there's nothing we can do about the arthritis because it's already here. There's nothing we can do about actually slowing it down or not having it affect me. It is already here. So if you don't know anybody, you now know a 34-year-old that has arthritis. So I have to get a full hip replacement. And so yes, I'm not supposed to make timelines for my recovery, but for motivation for myself, I made the timeline. I said I wanted to walk by December 2020, and I mean December had 31 days, and so at the end of the day, you know, I was like 31 days, so by the end of December into the new year I could actually walk like a normal person. But I cannot walk like a normal person. I cannot learn to walk anymore until the next 6 months when we do another checkup. So in 6 months, if the femur is not healing, I actually have to do, this would be the 4th surgery on my left femur. And what they're going to be hoping to do is taking bone marrow and sealing the break. Because I have so many things that's happening for me, I cannot actually use my own bone marrow. I have to use bone marrow from other family members, which, you know, that's a whole long process. And I'm really devastated about everything, because then you guys see how joyful I am when I started to learn to walk, when I could come up the hill, when, I mean, yeah, I almost fell, but anyways, it was moving from being immobile, because when my accident happened, I was on my back for 6 months. I could not move. I couldn't even lift my hands like this. And then moving from immobile to learning to walk again, to learning to swim, having to go back to surgery, being immobile again for like 3 months, and then learning to walk again, just for my orthopedic surgeon to say to me, deana-rae, you have to stop learning to walk. You have to walk with your crutches for the next 6 months. And there is really no reason that he can currently give to me why my femur is not healing. He literally does not know. So if you're watching my video and you have some doctor, or you know why my femur probably is not healing, or you want to give me a suggestion, please leave it in the comments, because I can tell you guys at this point, I'm not going to say that I have lost faith in walking. I have lost some faith, and I know my subscribers that, you know, believe in a higher power will say, keep praying, keep pushing. I've come so far, I have so much more to go, and I understand all of that. However, I wanted to walk. It's been 1 year and 6 months since my accident, and people that have been in my accident, or people that have been in other accidents that's similar to mine with similar injuries, because I have a support group that, you know, I help other accident victims or trauma victims, you know, go through their day, actually give them some of my meditating tips to help them mentally overcome what they're going through in their new normal. And I have a young lady that was in an accident on the 1st of August, and both of her femurs were broken, and 2 months later her femur is completely healed, like the break is gone. 1 year and 6 months later, my femur cannot even budge. So I am feeling very defeated. I'm feeling very discouraged. I am wondering to myself, who in my lifetime did I do so wrong? Why everything that I have done up to this point is not helping me to heal in a way where I can say I am back, or the new me is healed, or whatever. Like, I'm just really tired. But anyways, enough of the ranting. That was my 6 months update on, well, yeah, my 6 months update after my bone graft surgery. So walking for December 2020, not happening. Walking into the new year, not happening. But I am still here. I am still alive. I am still going to stay as close to God as I possibly can, because then without him nothing could be possible, and then I could be in a worse position. I could have been paralyzed, probably. Yeah, I could have been paralyzed, and then, you know, my goals would have been different, because then, you know, paralysis, you don't walk ever. But I am feeling defeated. I'm very disappointed, because I felt so good and so alive and so, you know, getting back to normal. I know I'm not a burden to people, but I do feel like a burden, because people have to walk slower because of me. They have to wait on me longer, and I'm not used to that sort of life. But anyways, as I said, enough of the ranting. Thank you so much for being on another video with me. I want to thank everybody for continuing to be on this journey with me, for continuing to encourage me, and for continuing to be in my corner, because now more than ever, that is very important to me. If you guys want to reach out to me, remember, you can follow me on all social networks. They will be in the end of this video. And remember to like and subscribe and share. Remember, if you have any doctor friends, if you have any friends in the medical field, if you yourself has been through something that I have been through, please leave it in the comments, because I welcome all information, and I welcome ways of how to cope with this disappointment and this defeat, because yes, I'm strong, but I need some help. So guys, this is your BBB. See you in the next video.